mean, single incision surgery or single incision laparoscopic surgery is sort of the next evolution in minimal invasive surgery, or what we call minimal access surgery. The difference between single incision laparoscopic surgery and traditional laparoscopic surgery is that you're dealing with one small incision versus 3 to 4 or 5 small incisions, depending on which operation you're talking about. Currently, we're doing what we call single incision laparoscopic gallbladder surgery and appendectomy. In the future, we'll be doing additional operations. There are many centers that are doing single incision colon surgery and stomach surgery, surgery for reflux, and things like that. The advantage of the single incision surgery versus the traditional laparoscopic surgery, we think is, certain because meniscus patients like less scars, so you have 1 scar versus 3 or 4 or 5 scars. Because you have 1 scar versus 4 or 5, you tend to have less pain. We think patient may actually recover a little bit faster. In terms of who should have a single incision laparoscopic surgery versus the traditional surgery, I think it's a discussion between the patient and the surgeon. For example, if someone is referred to me for gallbladder trouble and I need to have their gallbladder removed, I will talk to them about both options, the single incision option and the multiple incision option. And depending on things like the patient body habitus or whether or not the patient has had previous abdominal surgery, if it's somebody who is younger, healthier, thinner, and has not had prior surgery, that would be a perfect candidate for a single incision surgery. Single incision surgery is the next evolution, and it's a little bit more challenging than the traditional laparoscopic surgery. But because we think that there are clear benefits for patients, it's something that we want to make sure that we're offering. So there are no clear contraindications or reasons not to attempt to do a single incision surgery in somebody, who is overweight or who has had previous belly surgery. It becomes a little more challenging. Doesn't mean that it can't be done.